Well, it's been a dream of mine to have a residency program at Eisenhower Health for years, and we had the opportunity 2 years ago to start applying for a residency program. We were approved, and we have our first class of residents that just finished this past July, and they've been excellent, have brought a lot of energy and interest to our program.
I would tell anyone considering Eisenhower for their emergency medicine residency that they should definitely take it seriously, because it really is a great place to learn. They have so many great faculty, so many great resources, really are supported, and really loved our experience.
When people come here, they're usually amazed by the area, the facilities, our emergency department. Our ER is giant. It's got 56 beds, resuscitation bays, a lot of staff and techs. All the rooms are full of equipment. You could run a major resuscitation in any one of those beds. All the ultrasounds that we have. We really have amazing resources here.
To someone that's considering Eisenhower for their emergency medicine residency, I'd say it's a great place to learn. We do not have any subspecialty residencies. We get to do everything hands-on. We get to be taught by the specialist attendings by themselves.
All the procedures, more than we can handle, are done by us, and they're letting us do very high-level procedures because our attendings are comfortable with it. They have done it before. So they're giving us that opportunity, whereas other residents, like a cardiac resident would be taking that, or an ortho resident would be taking.
When you're a second-year resident, you're actually caring for the patient. You're doing the procedures. You're the one that's spearheading the care of the patient under the close vision of an attending physician.
I love the Coachella Valley. I love waking up every day in a place that's sunny. There's a bunch of great restaurants, great art, a lot to do. It's a great community, and it has a smaller feel than those big cities, but you're still in beautiful Southern California, so I think it's a great place to be.
This is not a small rural community by itself. It's one of the busiest emergency departments in California. It has one of the highest acuity patient population in California. You have some of the nicest patients I've ever seen, and I've been all over the US. I'm from the Midwest. I trained in Detroit, been on multiple locations on the West Coast, and I can tell you these are the nicest patients I've ever taken care of, the most appreciative, and that's quite unusual.
As a new emergency residency program, they've allowed us to pursue interests and things that otherwise may have already been instituted. We were able to start a wilderness medicine curriculum, and myself and some of my fellow residents were able to do a camping trip up in Joshua Tree, as well as a hiking trip at the Ladder Canyon in the East Coachella Valley as well. I definitely do feel challenged. We have a high level of pathology as well as a high census here at Eisenhower's emergency department. We see a lot of patients, and we see a lot of sick patients.
Out of all the experiences I had as a med student, it is the most fun I've ever had being in a program, working with the people how I'm working. My impression that I took away from Eisenhower would be that it doesn't have to be painful. It can be a lot of fun, people can be super nice, and you can still have a life outside of medicine and work in a crazy ED with a bunch of sick people.
I would tell somebody who is considering a residency at Eisenhower that this is somewhere you can be and really form and shape an upcoming and new program that I can already see is going to be one of the best programs in the country, just because our faculty take such pride in what we're building here, and our residents do as well. And we're all best friends, and we really are family, and we would love to make you a part of that family.